Another long-term care facility is closing in Colorado. This time it's in our area. Parkmoor Village Healthcare in Colorado Springs will officially close later this month. The Colorado Healthcare Association tells us it'll be the 11th in the state to close during the pandemic. It's the third facility in our area to close. Laurel Manor Care Center in Colorado Springs closed in November 2020. Cripple Creek Care Center in Cripple Creek closed 2 months ago.
And News 5's Mayo Davison joins us in studio. Mayo telling us why these facilities are closing their doors.
It all comes down to empty beds. Occupancy is down 15% for all 244 facilities in the state, but the operating costs are still there.
Grandma has cancer.
It's been tough for Melissa Hall and her family.
It's a really hard thing. My grandmother is scared.
She is currently in the hospital, but they're trying to figure out the best steps forward, which may include moving her into a nursing home.
It comes down to, those skilled care facilities. How good are they? Who is working there? What is happening? What is taking place?
For many, that includes looking into smaller care facilities or becoming a caregiver themselves.
Since COVID began, we've seen this uptick in the number of nursing homes closing around the state, and it's two-factored.
Doug Farmer with the Colorado Healthcare Association says it has to do with staffing shortages and fewer residents in facilities. Prior
to COVID, our average was around 80% occupancy in the state, and now we float closer to 70%. And so that difference, that's about $200 million in revenue.
The association says 76 nursing homes statewide are sitting below 70% occupancy. 6 of those are here in Colorado Springs and 2 are in Pueblo. But fewer residents doesn't change operating costs.
The heat bill is still the same, and the AC bill is still the same, and the janitorial bill is still the same.
But the State Department of Healthcare Policy and Financing is working to find solutions.
Use additional dollars to provide stabilization, while we're also working with that industry to drive towards a more transformational long-term solutions.
In the meantime, families will do what is best for their loved ones.
I'll do what I need to do. But it's hard, and I think you have to be realistic.
The Colorado Healthcare Association says the state needs to address Medicaid reimbursement rates. They say 70% of nursing home stays are covered by it, but rates are not sufficient. The state says they have zero flexibility when it comes to rates because of how nursing homes get paid. It's outlined in state statute. They are working on other solutions, but just couldn't tell me just yet. Diane and Allison?